So really appreciate this opportunity to speak about direct primary care. So I am going to start with where we are today. So the problem with traditional health insurance. The first, even though 92% of Americans have health insurance coverage in 2023, it's really almost effectively uninsured because they can't afford it, and it's lack of access, and that's mainly because of high deductibles and out-of-pocket expenses. Those two things. So access is very limited, long waits, rush visits, endless testing and referrals, and surprise bills. The U.S. healthcare quality just dropped basically that's a Gallup poll that was 24-year low with this going on. And then in this study, so as we see, our quality keeps going down, and in 2023, premiums rose 7%, 2024, another 6%, 2025, 5.8%. So we're continuing to pay more, and employee care and satisfaction continue to decline. So in our view, DPC really is the solution that your business needs for all of those reasons. It's a membership-based model where patients pay a flat monthly fee for unlimited primary care. No insurance, no copays, no surprise bills. So the whole DPC model is meant to be like car insurance. You pay, you have health insurance, but it covers major things, but not routine care. Like you cover accidents, but not oil changes. DPC, the reason DPC is so cool is your employees, they would really have access to that same day or next day appointments, 24/7 direct access to their doctor. This is almost like having a doctor in your family that you can text and call. Phone, text, email. It really uses today's technology to have your doctor in your fingertips. Medications, dispensing at wholesale prices, discounted labs, imaging. And as a doctor, one of the things that's very gratifying is the long visits that are personalized, where you get to really look at the whole patient as one individual. And you really get the chance to use the reason you went to medical school, that knowledge, to be able to take that whole history to figure out what's going on. And all really for that monthly membership fee. So what this means specifically for an individual business is it reduces your overall healthcare spending, because instead of when your employee would call and they can't get into their doctor, they would often go to an urgent care or to something else. That drives healthcare costs to be higher. This one, they have access to your doctor. Maybe a text would have solved the issue, not an urgent care cost. Lower insurance premiums because you'll only need to cover the major care. Decreased absenteeism because they actually got the answer early instead of got sicker and sicker to get the care. Increased productivity, boost retention by offering a meaningful, valuable benefit, and improve overall satisfaction, loyalty for your employees. So DPC increases quality at decreased cost. Very rarely is there a business model where you can increase quality and decrease cost at the same time.